Hello, I'm Dr. Jessica McCain. I'm the founding physician of Southern Comfort Health Direct Primary Care. And I'm so excited to show you what our clinic is like. It's like a home. And what we do is we solve a lot of the issues that healthcare has. You know, those rush office visits, the impersonal care, always asking permission from the insurance companies before we do what's right for the patient. None of that. Here at Direct Primary Care, we're membership based, which means that we contract directly with the patient. So we are one-on-one personal relationships. We cut out a lot of overhead from being paperwork secretaries of the insurance companies to provide direct access to our patients. So here's the tour, and I'm going to talk about the services that we offer as we go along. So we're starting out in our living room, and I'm calling it a living room, not a waiting room, because you're not going to wait. Our patients don't have wait times. You're not going to be in a room with 20 other people waiting to see your provider for 10 seconds pretty much. So we want you to live. This is also our dream, to have a good place for community support. So we've had cancer support groups and other organizations use this facility for some community growth and activities. In the future, we plan on hosting nutrition classes here, anti-smoking classes here, anything that we feel that could benefit a lot of our members altogether. So let me introduce you to the other person who is in our clinic. It's really just the two of us, so we're really going to know you very personally. And this is my medical assistant, Ginger. So let's go into our exam room.
Hi there. My name is Ginger Ferreira, medical assistant, office manager of this practice. This is the clinical room where we do all the procedures, EKGs, blood draws. We can clean out your ears, ear lavages.
We do
a little bit of everything.
Yeah, we do everything that a normal clinic will do, but actually even more, because we've got the time to do it. So we try to avoid any referrals to a dermatologist, because here, you've got something abnormal, let's cut it off. I'll send it to pathology. We'll take it as far as we can ourselves. I'm just looking at one thing we got. We just got this in this week. It's a pessary fitting device for women. So for example, we're always increasing our services that we're providing as patients are needing it. So a lot of great things, but basically this is where all the procedures and the exam places happen. I do female procedures, IUDs, endometrial biopsies. If someone gets a cut on the weekend, we're going to meet you here to sew you up. Our goal is not to get you to an urgent care. Don't go to the ER, because a lot of times if we follow each other and if I can keep up with you morning, night, throughout the weekend, we'll prevent you from going to the urgent care for any pneumonias or any type of mild traumas that you have. So that's kind of basically this one big room. And like I said, it's the two of us, so we're really going to know you very well. So let's come into my room. And this is what I'm going to call like the consult room. So you don't have to be sitting in between an exam table to talk about your normal lab results. We want you to be comfortable when you're here. So what we're going to do is we're going to have a lot of our visits in the comfort of this room and go over what our game plans are, wellness planning for the future. Most visits are an hour long. Sometimes I've had visits going to 2 hours, but in general, like 30 minutes to an hour is our average time for an appointment. So nobody feels rushed. Everyone gets their answers. And then a couple of extra things is, the first visit, what we like to do is summarize all of your medical care you've ever had. We'll go and gather all those records, read in between the lines. A lot of things sometimes slip through the cracks. We'll help you get that all organized, and I'll write a good medical summary for you. And then we'll help you coordinate with getting to specialists that you need if you need a specialist. One thing that our members have access to is our membership with Rubicon Md. So what that is Rubicon is a company that contracts out with specialists. So there's 120 different specialists, all from the ENT, orthopedic doctor, psychiatry, nutritionist special, OB, and I can send them any cases I want with whatever information, questions. We can go back and forth with specialists. Usually 24 hours we get answers. So before I ever send a patient to a specialist, I'm going to go ahead and get a consult from a third-party consultant specialist, just to see if we're headed in the right plan or if there's any possible thing we can do before we have the expense of seeing a local specialist. So I think Rubicon MD has been really great. I learn a lot, certainly, from being able to interact with specialists on command. I always like having EKGs run by the cardiologist. So even though I'm telling you, yep, your EKG looks fine, if you just feel more comfortable hearing that from a cardiologist, let's go ask them. So that's another great service that we provide is actually access to third-party consultants who can review your case, and feel free to ask them any questions. Again, no time limits on that. So this I also want to highlight. This is our pharmacy. So we are a pharmacy just like any other, except for we carry generic medications. A couple of things we have a little bit harder time carrying would be, the brand name asthma and COPD, inhalers and insulins. We help patients get the best price, and what we mean by that is we go to GoodRx, and if GoodRx at a pharmacy has the price at much lower, we'll tell you where to get it, and we'll even send the coupon to the pharmacy in advance, so it's all done by the time you get there. But almost 99% of the time, we're beating GoodRx prices with our prescriptions. And I'm even talking over-the-counter medications, so vitamins and supplements. And we have a big row here of just some of our beginner vitamins and supplements. We're going to be rolling out another SoCo wellness line, which has like immune boosting CBD supplements, elderberry, fresh extract. It's a whole nother component to SoCo, the clinics in general that we're going to be offering. But just to give you an idea of the savings, like even for over-the-counters, when you're using our SoCo pharmacy, say if you wanted to buy Wallatin. Wallatin at Publix on the line as you're going out, I think I saw it for like $6.69. You get 5 tablets in that box. Well, I can get you 365 tablets for $11. So that's kind of an idea of an over-the-counter savings. Majority of them is 50 to 80%, but that goes for prescriptions as well. And majority of our prescriptions, like a 90-day supply, may only be like $2 or $3. So that's why a lot of our patients, even when they have insurance, sometimes we still beat that $5, $10, $15 deductibles or co-pays that they have to pay for prescription medicines. So this is just kind of one of the great benefits is actually a discounted pharmacy because, again, we don't have to inflate our costs because we're not going through insurances. Let's head over to some other cool aspects of our house. Our house is actually 108 years old. It's been remodeled to fit in to be ADA accessible. We have a ramp that goes to our backyard parking lot in the back, as well as some front door access. We want to keep it very comfortable, so we have a little kitchen in here. I mean, if you want to come and have some coffee and chat with us, we've got a coffee station set up for our patients. So I don't mind. I work through lunch a lot of the time. So here we are, and we're just trying to keep it really comfortable. So let's go this way. I'll show you that we are kind of family friendly, and you're going to see a lot of toys and things like that because sometimes I bring my kids to work, especially with the daycares being closed. But we also want families to not feel like they have to get daycare in order to take care of themselves. We see a lot of moms who maybe self-neglect. We see even sometimes, adults who are caretaking for their elderly parents. Sometimes they neglect themselves. So we don't want that to happen, and to kind of overcome that barrier, we have a place for the kids to stay and hang out. So this is the kids' office. I'm going to open up the door to see if you can climb in here and see it, but my kids love playing here, and it's a place where they can just create a mess if they want to, and it's all secluded and it's quiet, but French doors lets us keep track of them. So this is just one thing that I think is really nice. So there's not really much of an excuse if you can't find childcare to come to your doctor. Just bring them with us. We'll take care of them too. We also do offer courtesy appointments for children who are members. We don't necessarily have a pediatrician. I do see pediatrics, but our clinic is built against for 13 years old and up. But if a member has a younger child and they need to be seen, we encourage to keep your current pediatrician because they've got the vaccine set up. Although you could go to the health department and get free vaccines. But as a courtesy, if your pediatrician's not available after 5 or on the weekend, or if you just had a quick question, we'll see your younger children as a courtesy as well. This is the final kind of part of our tour. It's something I've always dreamed about. It's called the resource room. When I'm out and about, I'll see a flyer that I think, wow, this patient was looking for this and this is perfect, and I want to share it with other people. So throughout the years, I've been collecting flyers and brochures and information, and that's where I came up with this resource room. We have a supplies closet, so these are actually free samples that we've gotten from companies, and we keep it pretty stocked. A lot of good things on there. You can get that free wallet in there too. But we have information here about health share plans, which is an alternative to commercial insurances for really a lot less of the price, and it still covers you for in the event you need to see a specialist or you need that imaging study or you go to the hospital. Health share plans are about 50% less than commercial insurances. So it's a great option to have. Health savings accounts, information, coupon codes for prescriptions. You know, if I see a flyer about how to get a free phone for hearing aids, like, I'm gonna grab it. Information about the county and services that they offer, a lot of free things out there that you actually pay for with tax dollars, like free smoking cessation classes and gums and patches. We're here to get you connected, and I think that's the biggest thing we do is try to get people connected with others in the community and try to work together. So we do put out even, you know, some business cards of local people that we've met and we really like to work with and send people to. So that's kind of our resource room, and that's kind of how we operate at Southern Comfort. Try to be a family like the doctor you've never had in your family. So hope to see you here.